So my name is Dr. Paul Alize. I'm a French neurologist. I was working 20 years in France, and I'm working in Phnom Penh since December 19. The migraine is a common neurological disease. The frequency is very high, 23% of the population. It's a recurrent headache, which can be very frequent, sometimes more than 15 days in a month. Headache in migraine have several criteria. It's full head headache or half head headache. Migraine means half of the skull. And this headache is very intense, progressively set up. It's accompanied with the nausea, with also sometimes vomiting, sometimes, and one very important thing is sensible to the efforts. If you bend over to pick up your pen, the headache will increase. So people are searching the rest. We don't know exactly the cause of the migraine. All what we know is there are some genetic forms and some form familial. Most of the migraine are familial. When one people comes from migraine, we note that his relatives as migraine also. Okay, but migraine has triggering factors. These triggering factors could be a lack of sleep, could be also for the women before the period before the menstruation. Can be also some alimentary factors, which are the most simple to avoid. This means alcohol, and in alcohol especially white wine and champagne, and also the chocolate and the sausages. But there is a lot of other, but these three are the most frequent. You have also the strong smell, like fragrance, like fresh paint, and so on. And you can have also the psychological factors. It can be joy, it can be stress also, who trigger the migraine. Some people, they have the migraine during the weekend when they change the pace of life. Usually they work a lot, very hard all the week. They are under pressure all the week, and when the weekend comes or the vacation comes, the migraine comes also, because this changing of the pace of life. It depends on the frequency of your migraine. You can, if your migraine is very frequent, this means more than one migraine per week, one headache per week, you have to take a background treatment. His aim is to reduce the frequency and the intensity of the headache. And you have also the crisis treatment you take in an acute phase of the migraine. The key point is to take the treatment as soon as possible, not to wait too much. If you wait too much, it's similar than when you have a fire in a house. If as soon as you see the flames, you try to light it off, it's easy. If you wait 3 hours, it will be the house will burn. The migraine is the same. You must take your treatment very fast. Okay, and this treatment are common treatment like, of course, paracetamol, aspirin, but also more specific treatment like we call triptan. Triptan, the most known is sumatriptan, is very specific and very effective treatment for the migraine. You should consult the neurologist if your migraine is too frequent, more than one headache per week, or if the migraine is too intense. Some people have to go to hospital for this, because the migraine is very painful, very painful. And of course, you have some red flags. If you have a sudden setup headache, you have to consult a neurologist. If you have a persistent neurological deficit, you have to consult your neurologist. If you have a very intense headache, you have to consult a neurologist. It's also important to consult your neurologist because we have to make the difference between the migraine and other severe form of headache. You can have some thing called cluster headache, which is very intense, very painful. It's different from the migraine, and it calls a very specific treatment. You can have also the facial neuralgia, which is very painful also, and needs a totally different treatment. And of course, you must eliminate a stroke. The stroke the setup is very brutal. It starts from 1 second to another. Instead of migraine, we start very slowly, very slowly. So if you recognize your symptoms, it's important to consult in Prestige Hospital for the diagnosis assessment and to perform some accessory tests like CT scan, for example, to rule out any other form of headache.
ប្រសិនបើលោកអ្នកមានអាការៈបែបនេះសូមធ្វើការពិគ្រោះជាមួយវិជ្ជបណ្ឌិតឲ្យបានទាន់ពេលវេលាវិជ្ជបណ្ឌិតបារាំងឯកទេសផ្នែកប្រព័ន្ធប្រសាទនៅមន្ទីរពេទ្យ The Prestige Rene Paul Alize បានប្រាប់ពីរោគសញ្ញាមួយចំនួនដែលលោកអ្នកគួរជួបជាមួយវិជ្ជបណ្ឌិតដូចជាការឈឺចាប់រ៉ាំរ៉ៃឈឺក្បាលរ៉ាំរ៉ៃទន់ដៃទន់ជើងស្លាប់មួយចំហៀងខ្លួនពិបាកនិយាយមានបញ្ហាក្នុងការធ្វើចលនាចុករយកញ្ចឹងកឈឺខ្នងឈឺចង្កេះរាលដាលមកកំភួនជើងនិងចុងជើងស្ពឹកដៃនិងជើងជាដើមសូមធ្វើការណាត់ជួបវិជ្ជបណ្ឌិតឯកទេសផ្នែកប្រព័ន្ធប្រសាទនៅមន្ទីរពេទ្យ The Prestige តាមរយៈលេខទូរស័ព្ទ023 26 69 99 085 68 95 68 067 68 95 68អាសយដ្ឋានផ្ទះលេខ16 18 ផ្លូវ21ជិតផ្សារកាប់គោវិមានឯករាជ្យសង្កាត់ទន្លេបាសាក់ខណ្ឌចំការមនរាជធានីភ្នំពេញមន្ទីរពេទ្យ The Prestige មន្ទីរពេទ្យស្តង់ដារអន្តរជាតិ